My name is Dr. Joshua Cohen. I'm a second-generation ophthalmologist and now the owner of Cohen Laser Vision Center in Boca Raton, Florida. And I've been in this practice for about 6 years. I did my undergraduate at Harvard, and then I went home and lived at home for a couple of years and taught high school for about 2 years, which was a lot of fun. Finished up my med school at University of Florida and then pursued my ophthalmology training. I started at University of Florida in Jacksonville, where I met my wife. Ended up transferring to University of Virginia and finished up there. Have been in this practice ever since and have been loving it. We're always trying to improve, and I think that strive towards perfection, especially when you're dealing with patients' vision, is a challenging endeavor. So it provides that other aspect, that daily challenge to keep improving and learning about the amazing technologies that are coming out every day in our field. My treatment philosophy for patients is do no harm. I think that is a mindset that every doctor needs to have, especially as a surgeon, and even more so as an elective surgeon, someone who's electing to undergo surgery that is not required. Refractive surgery, by definition, is a convenience. It allows patients to enjoy their life to the fullest without glasses or contacts. I think that it's an amazing thing to be able to offer patients, but we really have to be cautious. So I try to do the least possible intervention to give the best possible result. And that is different for every patient. It might even be different between someone's left and right eye. Not every patient turns out perfect, and not every experience is what you expect it to be, but that's the nature of medicine. We're constantly learning. You sit down with the patient and speak with them frankly and say, look, this is what I recommend, this is why. This is what I would not recommend, and this is why. And I invite you to read more about these different options and come back to me when you feel comfortable with making a decision. So me personally, I had LASIK PRK, which is a modified form of LASIK. Really great for some patients like myself who had thinner corneas. My dad did my eyes when I was 18. And it was my graduation present from high school. But I think that at the end of the day, for my dad to feel so confident in not only his skills, but also in the technology to do it on his own son, I think it really speaks volumes to what this technology can do for people. And here I am 20 years later, I'm still seeing beautifully, I'm seeing better than 20/20. That has allowed me to do what I do now. We need to have good vision to do what we do too. We really have to look at microscopic little imperfections and details in patients' eyes. So we really need to have the best possible vision possible. I would recommend the same treatment to someone walking in on me for the first time than I would for my own child or my own parents. For me, that post-op day one appointment when patients come back from cataract surgery or LASIK or ICL, and they come in and they're reading more than they ever have without glasses, sometimes better than they did even with glasses. There's no feeling like that. It's unbelievable. You just feel like you can just see it. Patients come in and from the moment they walk through the door, you see they're smiling, and it hasn't even been 24 hours and they're coming back and they're like, this is great. That feeling is kind of what you chase in this field. To see patients kind of take the risk and sign the papers and say, I'm basically trusting my vision to you, and that's not something we take lightly. And then seeing the consequences of that, is an amazing thing every day.